Why pain persists even when scans are normal. A holistic, hope-centered understanding of healing. Introduction. Dear friends, if you are watching this right now, chances are you have been living with pain, illness, or symptoms that just will not go away. You may have visited many doctors, you may have taken many medicines, you may have done many scans and tests, and still, your suffering continues. Maybe you were even told, your reports are normal, but your pain is very real. If this is your experience, I want you to hear this clearly. Your pain is real. Your suffering is real. You are not weak, and you are not imagining it. In this talk, I will help you understand why pain and health problems can persist even when scans are normal. I will also share how the nervous system, stress, emotions, hydration, food, lifestyle, mindset, faith, and even energy-based therapies can influence pain and healing. Please stay with me till the end. What you hear today may be the beginning of a new relationship with your body and your healing journey. Pain is not always the same as damage. One very important thing to understand is this. Pain is not always caused by damaged tissues. Pain is an alarm signal created by the brain and nervous system to protect you. The tissues send signals. The brain decides if those signals mean danger. Then the brain creates pain to protect you. Sometimes, even after tissues have healed, the alarm system stays on. The scan may look normal, but the nervous system may still be in danger mode. That is why pain can be real even when scans are normal. Sensitized nervous system, the volume knob. In many chronic pain conditions, the nervous system becomes too sensitive. The pain volume knob is turned up. Small signals feel big. Normal movement feels painful. Light touch can hurt. Stress can increase pain. This is called nervous system sensitization. This is not weakness. This is real biology. Why scans can be normal. Scans like MRI and X-rays show structure. They do not show nerve sensitivity, brain pain circuits, pain memory, stress effects, autonomic nervous system imbalance. So a scan can be normal, but the nervous system can still be stuck in protection mode. Pain can become a learned pattern. When pain lasts a long time, the brain can learn pain. The pain pathways become stronger. The brain expects pain. This is sometimes called pain memory or neuroplastic pain. The good news is this. If the brain can learn pain, the brain can also learn safety and calm. Pain can be unlearned in many people. Emotions, stress, and mental health. Emotions and mental health strongly affect pain. Anxiety, depression, fear, trauma, and long-term stress can lower pain threshold, increase nervous system sensitivity, keep the brain in danger mode. This does not mean pain is fake. It means the emotional brain and pain brain use the same circuits. Attention, imagination, and expectation. Where attention goes, nervous system sensitivity often follows. Focusing on a body part can increase pain there. Imagining danger can increase pain. Imagining safety can reduce pain. The brain does not fully separate real and imagined threat. This is why guided imagery, reassurance, and positive expectation can reduce pain. Why reassurance helps. Many people notice that when a doctor says, there is no serious damage, their pain reduces. Fear reduces. Muscle guarding reduces. The nervous system calms. This is not weakness. This is how the brain's protection system works. Hydration and pain. Chronic dehydration can worsen pain. Dehydration can make muscles stiff, fascia tight, discs less hydrated, trigger points more sensitive, nerves more irritable. Dehydration is usually not the only cause of pain, but it can keep pain going and delay healing. Food, drinks, and inflammation. What we eat and drink can influence pain. Some foods reduce inflammation, some increase inflammation. Ginger, turmeric, omega-3 fats may help reduce inflammatory load. Excess sugar, ultra-processed foods, and alcohol may worsen inflammation and pain. Some drinks and foods may affect blood vessels and trigger headaches or pain in sensitive people. Food is not just fuel. Food is information to the nervous system. Essential oils and topical support. Some people find relief with topical oils like castor oil or essential oils. These may help circulation, relaxation, and pain perception. They are supportive tools, not cures, but they can help some people feel better. Placebo, belief, and the brain's pharmacy. The placebo effect is real biology. Belief and expectation can cause the brain to release endorphins, dopamine, calming chemicals. This can reduce pain and improve symptoms. This does not mean symptoms are imagined. It means the brain has its own pharmacy. Meditation and visualization. Meditation and visualization can calm the nervous system. They can reduce stress hormones, improve sleep, improve pain tolerance. Imagining healing can activate safety circuits in the brain. These practices support healing, but they do not replace medical care. Hope, miracles, and spontaneous healing. Medicine recognizes that rare, unexpected healing can happen. Some people improve in ways that science cannot fully explain. These stories remind us that healing potential may be greater than we understand. We cannot promise a miracle, but we never close the door to one. Faith, individual biology, and God's grace. Every human being is unique. Even with the same diagnosis and same treatment, people can have different outcomes. Modern medicine cannot guarantee cure. From a faith perspective, there is also grace, mystery, and God's will. Healing is not a test of faith. Healing is not a reward or punishment. We do our best, and we leave the outcome in God's hands. Energy medicine, a balanced explanation. In my clinical experience, I have seen people improve in sleep, pain, and migraine after energy-based and relaxation-focused therapies, even when other treatments had not helped. Many of these therapies may work by calming the nervous system, reducing fight or flight, increasing rest and repair, reducing pain amplification. These therapies are supportive and complementary. They do not replace proper medical care. Some people improve greatly, some partially. Some may need other treatments. We offer them with humility and compassion. Lifestyle practices that support healing. Gentle exercise helps circulation and calms pain circuits. Sunlight helps mood, sleep, and vitamin D. Being in nature and grounding can calm the nervous system. Spiritual practices reduce stress and bring peace. Loving kindness, forgiveness, and compassion calm the heart and nervous system. Honesty, integrity, and good intention reduce inner conflict and stress. All of these send safety signals to the brain. The big picture. Pain and illness are rarely caused by only one thing. They are influenced by nervous system sensitivity, stress and emotions, hydration and nutrition, sleep and movement, belief and expectation, faith and meaning, lifestyle and environment. Healing is whole person.
Conclusion. Hope, humility, and peace. How we come to the end of this talk, remember this. Your body is not your enemy. Your nervous system is trying to protect you. You are not broken. We will do what we can with science, compassion, holistic care, and sincere effort. We will care for the body. We will calm the nervous system. We will support the mind and the heart. And then, with humility and trust, we leave the outcome in God's hands. Miracles have happened before. Unexpected healing has happened before. We cannot promise a miracle, but we never close the door to one. By God's grace, you may be the next one. And even if full healing does not happen immediately, meaningful improvement, peace, strength, and relief are often possible. We do what we can sincerely and lovingly. We walk with knowledge, compassion, and faith. And we trust God with what is beyond our control. May this be the beginning, not the end, of your healing journey. Thank you. Founder, Holistic Wellness Foundation. Imphal, Healing Beyond Boundaries.